Hey everybody, Troy again with the Advanced Spine Joint and Wellness Center here in Medina. Hey, if you've caught our 4 and now 5-part series and you've been following us the past few weeks, we've been talking about spinal stenosis and sciatica, and we've talked about a lot of things, but today's going to be the last little segment on this, and today we're going to talk about curves. But if you haven't caught them previously, the first one, we talked about some of the symptoms of spinal stenosis and sciatica. Second, we talked about some of the causes. Third, we talked about some of the treatments, and now in 4 and 5, we're going to talk about some of the alignment issues that are very common. In the 4, we also really got into a lot of the imaging. So today what we're going to talk about is curves. Before we get into it though, if you're looking for us, you can find us. Easiest way to find us is just search for us online. You can put in a Google search for ohiopain.com. You'll find our website, and there's a lot of information on there. And there's a link on the screen as well if you're following us on Facebook Live or if you catch this on YouTube. So today we're going to talk about curves. Now, if some of you have visited chiropractors or maybe physical therapists, perhaps you've heard this before. Chiropractors typically talk about this one a lot, which is the curves of the spine, and they're designed to be 3. And we're going to talk about these today and how they can contribute to this problem and potentially make it occur and or worse. So if we look at the spine, especially from the side, so this is looking at the spine from the side, we should have 3 curves in the spine. One is in the upper back or neck, one is in the mid-back area, and one is in the lower back area. And I'm just going to reference the one in the neck, but this applies to the lower back as well. And the curve is actually critically important. Some chiropractors will call it the arc of life, in that when we lose curve, we're going to start to see dysfunction, and there's a lot of truth to it. But what happens is when we have normal curve, to kind of look at anatomically what's going on, our head is perched up on top of this, and all of the weight then of our head is going to translate through these little small bones here in the back of the spine. And that's the way it's designed to take stress. Now, if you can see close enough, if I squeeze the spine this way, which is the way it's designed to be, we can see that that keeps our disc spaces open and keeps pressure on the discs and kind of pushes them forward. Now, what often happens is we will see patients and we'll see either loss of curve where it's straight or even the reverse of curve. Now, what causes the potential straightening or reverses the curve can be different in a lot of people. The number one cause is old car accidents. So people that have old car accidents and continue to have neck pain and pain radiating down their arms, spinal stenosis, sciatica, it's because we typically see a reversal of the curve. The second potential cause of loss of curve is now tablets, screens, and phones. So a lot of us are just glued to these things nonstop. You can't even stop at a stoplight anymore without people. You look around at the stoplight, everybody's looking at their phones. So we're getting into these forward postures where we're constantly looking down at the phones. And what that does is it slowly begins to train the spine into a forward position. So the first potential cause, car accidents. Second is phones, tablets, and screens. And then third, reason that we see this a lot, is people are now performing more work at home-based workstations. And many patients are working just at a seated position for prolonged hours, sometimes up to 8 to 12 hours throughout the day. So we get into kind of these slouched forward positions where we start to see some of the loss of curve. Now, why is the loss of curve so important? And again, we're talking about the neck, but this also applies to the lower back. So again, if we go back to normal curve, what we see is that when we have a curve, these little spaces stay open and there's no pressure on the discs. But as we begin to lose and then reverse the curve, we're now putting a tremendous amount of stress and pressure on these discs, and it starts to lead to degeneration. And I'm going to bring these little models over here to kind of show degeneration. So what happens then is now, instead of having proper stress on the discs back here like this where they stay open, we begin to put forward stress onto the discs, and they're not designed to take stress that way, so it begins to damage them. And what happens is over time, we start to see degeneration. And we're going to be talking about spinal stenosis and sciatica. So what happens then, if we keep leaving this disc in a forward position like this, we're going to start to damage it. And the more we start to damage the disc, we start to lose its space, kind of like the tire tread on a car. So we start to lose this spacer, and then we begin to lose our tunnel over here. So as you can see here, we've lost our spacer. Now look at the size of the tunnel. We begin to pinch it, pinch the nerve, and that then begins our symptom. So if we look at the difference, you can see normal space, normal tunnel. Here, smaller space, smaller tunnel. Then eventually we begin to pinch the nerve. So when we're talking about spinal stenosis, really all that word means is tunnel smaller. We pinch the nerve and now we've got problems. So when we talk about rehabilitating spinal stenosis, I'm going to put a link up for a study. There was a great study that was done, and it shows that 80 to 90% of patients, when we have what's called foraminal stenosis, which is these little tunnels on the side of the spine, 80 to 90% of the time when we have foraminal stenosis, we can improve that without surgery. It's just really thinking our way through what are the causes, what do the images show us, what does the exam show, and what kind of deficiencies are we seeing with the examination, at least neurologically. So curves are a big part of it. And if nobody's looked at or talked about curves with you and you've seen a chiropractor or perhaps a physical therapist, it's a big part of establishing the diagnosis and then, most importantly, long-term and even short-term treatment. So curves are critically important. Again, the arc of life. We talk about that a lot here. So that's a big part of our problem. So short today, and that's going to wrap up our little mini series on spinal stenosis and sciatica. And if you're looking for us again, you can find us on ohiopain.com, and you can contact us directly, 330-242-7669. And next week we'll start a new series, and we certainly look forward to it.